Good afternoon, everyone, and welcome to the Brownsville Independent School District Board of Trustees Insurance Committee meeting. It is Wednesday, June 15th. It is 5:30. Reviewing first with item number 2, administration introductory remarks. Dr. Montoya.
President Garcia, Ms. Longoria, and audience, obviously one of the things that we pride ourselves here in Brownsville ISD has been that our insurance program in general has been very friendly to our staff and with a lot of options, one of which obviously is the medical side that has been around in various forms for various years, and we want to obviously continue that, but the other half of the coin, the voluntary programs, things like dental, eye, life insurance, and other programs, disability and those types. So we hope that in the upcoming weeks, as these committees meet and the full board meets, that we comments on programs for our. And I know that we will, as we listen in the future to vendors and to present various subgroups. So we know that's what it's about, and it's important. With that being said, we move on and hope that, and I know we will tonight, some information from the ad hoc committee to share with all of us, and then we move from there, ma'am.
Yes. And now we go to item number 3, the insurance ad hoc committee.
Good evening, everyone. President Garcia, good to see you. Dr. Montoya, Ms. Longoria. I sent you this report in an email, and I was hoping Mr. Whittemore would make copies and you could follow with me. I don't think you have it in front of you, do you? Any of you guys have any report in front of you?
No, we don't, sir.
Okay.
Is that the major highlights?
I think Mr. Whittemore is making some copies, but I sent it to you anyway in an email. But I'll start as you go along with this. What I tried to do is consolidate, all the ideas, suggestions, recommendations, arguments, everything else from our committee, and basically pull it together in a form that will help at least the board, not only the board insurance committee, but the board of trustees, to also offer a concrete suggestions on some of the many presentations and suggestions that we had during our several meetings. So that's what you see in front of you. And I'm going to start by saying, I want to thank all the people that work at BISD, because it's a lot of work to create a lot of these reports for us. We try to minimize those as much as we could, and there were many agendas at our meetings as we went around discussing several suggestions. So let me walk through here. In page 2, you're going to see some major highlights, analysis, and observations that we had throughout our presentations. Some, as for example, are the pharmacy rebate program. There were continuous questions and reviews about the reports, how accurate they were, how accurate they may not be. Someone needs to look at that. I think Eric from MAA did a good job in ensuring the accuracy of some of those. However, questions still endure even today. So remember, we have 24 people. Out of the 24, maybe 16 were pretty active all the time. Several folks never showed up to our meetings, and you can't really control that. But you also have to remember that out of the 16 folks that are active, maybe 4 or 5 really are the ones that are working behind the scenes and getting a lot of this done. A lot of it is the BISD staff, so my hats go off to those folks. Excuse me. The stop loss contract, for example, and these are some numbers that came out of the presentation. So again, my whole point is now that the board has hired a consultant, they can go back and reevaluate some of these line by line and validate some of these things that are being reported. The data indicates again that the contract year was 13.84 per member per month. However, there's a difference of 73 cents per member per month. That's some of the things that came out during our discussion and presentations at the meeting. Again, it's important to reevaluate that and validate that. Just because 1 or 2 or 3 of our members are picking that up doesn't necessarily mean that that's accurate. And I want to make that point very, 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 very clear, because the data that we see is only the data that's being presented to us. There's also some comments on the runoff fee. I'm not going to go line by line on this, and not it'll take too long. You can read it there because it's for your guidance. The monthly global fee also was addressed. The actuaries and utilization It's projected to increase by $9 million next year, your plan. We don't like that when you look at economies of scale, the amount of lives covered. Hopefully we can improve that plan somehow as BISD continues to grow and move forward. Obviously an actual review is recommended by our committee, and we'll get to the final recommendations in a minute. Number 6, increase in claims. There's a report that increased the claims by 18%. Again, we need to look at that very carefully, make sure we, meaning you, very carefully to ensure that that is accurate and what is driving it up. Eric, again, explained a lot of this information in questions, and Mr. Whittemore also has the responses of the questions as well, and he can easily share those with you. I don't have those with me. MAA right now is the record keeper. Again, BISD has to reevaluate that through the consultant, make sure that that's what they want to ensure that they are accurate and complete. Direct contracting and subcontracting, this is a lengthy discussion that we've had at all of our meetings. And I think all of us agree that there is some potential for direct contracting. On the other hand, in theory, it sounds fantastic. It sounds like you can start it up today and you're being business. In practicality, it doesn't really work that way. So, it was very hard to get consensus on what really was needed. But it started coming up at every meeting that it was important for me to put it on the report to say, I think it's worth looking at and see where it takes the BISD. BISD grows and either family members get added or deleted from the plan. Direct contracting could be beneficial. It could not. Again, now that you have a consultant, hopefully they can focus on that to ensure that it is in the best interest of the entire district. Not, just a few, but the entire district. Let's see here. In summary, the summary recommendations, again, the actual study is very, very important. We were surprised that it was not done. So, or at least that's what the report that came to us, that there was no actual study done regarding the plan. So it is important to do one by an independent licensed actuary to determine the funding levels of the plan. Number 2, again, explore and analyze direct contracting through the consultant. They should have a lot of experience in that. There are several members in the committee, more the insurance experts than anything, that kept on pushing for direct contracting because they believe it is the good thing to do. And it may be, who knows. However, there's also a lot of staff members in our committee that don't believe it really works. So it's one of those things that it was a struggle to really get consensus of what really is needed or not. It's going to have to take more and more review and more review as you move forward with it. MAA, the committee in a consensus pretty much wanted to renegotiate the existing contract with MAA because overall we had a pretty good feeling about what MAA was doing. A lot of the employees like what MAA is doing. Some folks in the end here started to change their tune on that. Very difficult to handle. So again, it's going to be your decision on what's done. Initially, when we started our committee, we were against going out for bids. We don't think that's a good idea. However, towards the end, that change started to change. So my understanding is you guys are going out for bids, which we didn't really even know. So we were a little disappointed and really, honestly, frustrated that you would go in that direction without even taking our consideration in it. But whatever it may be, you need to do what you believe is right for the district. Consultant, now that you've hired one, I think they can, again, focus on actuarial review, explore the direct contracting, and also they were negotiating with the MAA. Under risk manager, we discussed this back and forth at our committee, and BISD is big enough that it should probably hire its own risk manager. I mean, there are so many issues with the health plan. It's so complex that you can't imagine. So the risk manager idea is not a bad idea. And again, this is nothing more than a guide, by the way. It will help supervise the medical plan, help manage the workers' comp, and other risk issues associated with risk management and quality. Transparency and accuracy, I wrote it in there because it continued to be a discussion back and forth. Some people believe that the data is accurate, other people don't. It's very easy for us to sit in a table and just shoot guns at everybody. Very easy. So we put Eric from MAA in a chair, and everybody just decides to shoot the guy. I, at the meeting, said, you know what, give Eric a gun so he can defend himself. It's not fair. So we need to figure out what really is and is not. And as a committee at our level, with so much diversification, it's just impossible because everybody's got their own ideas, their own tendencies, their own agendas. They're really their own focus on what they want. So hopefully this will serve as a guide to you guys to at least know how diverse it is so you can try to home it together through the consultant to help you kind of guide in the future. And again, this number 6 is very important because that does not mean the data is inaccurate. It just means it became out as a discussion over and over and over and over and over again. You can't imagine how you can determine, or me as a chairman of the committee or the rest of the members, who really is telling the truth in the group. We don't know. It's someone's opinion, and opinions are a dime a dozen. So someone needs to go back and dig a little deeper to make sure this data is there. Again, MAA has a lot of data. You know, McGriff has done a good job for you guys in the past, I understand that they're back, so they may be able to help you through a lot of this information. I should have drank some water. I'm sorry, I'm so dry. Really, as far as our ad hoc is concerned, we tried very hard not to get away from the day-to-day stuff, even though we were constantly being pulled towards that direction. But overall, the committee accomplished what it was supposed to accomplish, which is dig a little deeper and look into this and come up with some suggestions. And again, this serves nothing more than a guide to you to help you hopefully answer the questions even deeper, or re-question the questions, what data really that you need, you know, for next year as you go through the plan. You are going out for bids, my understanding, so that should bring in a lot of data. But this should help you at least with a lot of the discussions that we had during our 4 or 5 meetings that we had. Thank you so much. So again, there are several members of the committee that wanted me to be super, super detailed in this reporting. I disagree with that mentality. And the reason for that, it just becomes personal. We don't want this to be personal. We want it to be business. You know, so it's a good idea to look at an issue and figure out through the suggestions, through the comments of the members, then determine what is the right move that you take. You guys are the ones that are in the front lines. The employees, Mr. Whittemore's staff has done an outstanding job. Mr. Fuller's staff has done an outstanding job. Really, all the BISD people have been wonderful to us at the committee. So I think it's important that we utilize their skills to try to get you the answers that you will need, because clearly it's not clear enough for any one of us to see. The folks that were in there that were the most vocal, of course, were the insurance expert, because it deals with insurance. The doctors, Dr. Diaz had some great suggestions. My ideas were more focused on operations, on how it really works out there in the field. You know, when you bring it all together, it's what you have in here now. But it's nothing more than a bunch of discussions and ideas and suggestions that'll help you get to the next level, we hope. There were many, many, many more discussions that were not included, and there were many suggestions to these guys whether to include them or not. The fact is, a lot of them became personal, and I try to really keep as much of the personal away, as much of the politics away of this whole thing, and give you at least a solid base. So that's what we've done here. I'll open it up to questions.
Can I have somebody else from the ad hoc to step up to the podium to discuss some of the issues that we've had and concerns about some of the, I believe we haven't been receiving payments or refunds in the insurance, and that shouldn't be an excuse, because I know that in the past we've been inquiring about what we're receiving, and this about we haven't received it is not an excuse. I will not accept any excuses when there's money out there that's supposed to be already given to the district 2-3 months ago. So I don't know how Ms. Longoria feels about it, but if any money is owed to us, it should be here with us on a monthly basis, no later than 40-50 days. And I think 50
And I
days
don't
is
know,
already
I don't know
pushing
what your plan says, but I agree with you.
You
I
know,
think some of the questions were answered by MA, but I don't have that
it.
detail
And
with
let me
me.
finish, because they're very good at taking our money. And just like they're good at taking our money, we better get our money back that's owed.
Sure.
As simple as that. No excuse. And this political, sir, with all due respect, we're not here for our political gain or anything like that. We're here because it's about our employees. It's what's best for employees. And let me tell you, my husband works for the district, and I am not very fond of the insurance either. I can comprehend what some of those people are feeling, because I myself have experienced it. And I don't know how Ms. Longoria has, but I've heard numerous complaints out there where, and that might be
Sure.
the reason why we're going out for our, you know, we're submitting what we're submitting. I don't know. I mean, I was told it was out. Maybe that's what's best for us, like you said. Maybe that's what's best for the district. And you're right. I mean, you're dealing with 18 different ideas, and you're not all going to, you know, you're not going to please everybody.
Right.
But the only thing to focus is what is the best thing for our taxpayers and what is the best for our employees, because we don't want for them to pay anything out of pocket, but yet we're self-funded. And I know of districts that are self-funded, and they're doing great, and they're paying less, and they have the right people monitoring what needs to be monitoring, and check and balance. It's a check and balance deal.
Absolutely.
And if we don't have anybody doing that, guess what? They're taking us for a ride. And just like they have in the past, they will continue to do so. We were told that we've saved $9 million. I wonder if those $9 million or $6 million are really factual, because I don't see it anywhere in the request of the documentation that was given to me. I don't see any savings.
And,
On
and,
the
it, and it's
contrary,
very hard
it
to see.
seems to have gone up higher. So now I have more questions, because we were told, oh, it was the greatest thing, but now I'm in doubt.
Well, and it, frustratingly enough, you're right. It was swinging down. It saved a lot of money. Now it's swinging up. To get a real finger on the pulse, very difficult with the information that's there. I'll open it to Mr. Whittemore or anybody else from our committee that maybe have those details. I don't have them with you. A solid base, at least to start discussions from now at a much deeper level than when we started back in April, when we started the ad hoc. So I'll open it to Mr. Whittemore. Maybe he's got some of those answers for you.
Gloria says she's got some
I have
questions
some
herself.
questions for you, Dr. Jimenez.
I'm sorry, say again.
I have some questions for you.
Sure.
You pointed out some discrepancies here, and thank you for your presentation. You gave us some very good information.
Welcome.
And my first question is, why didn't the ad hoc committee participate in the selection of the consultant and also the health plan?
That came to us initially when I first came to present to you guys one time, the only time I presented. I've asked for direction. I only got direction from Dr. Escobedo and Mr. Springston, and it was very clear to make sure that the ad hoc didn't get involved with what the district is supposed to do. And that's one of the reasons the majority of the members of the ad hoc committee didn't want to touch the consultant, because several of those people in that room are consultants, number one. Number two is a lot of us that are not consultants certainly are not the experts at that. So we felt we did not want to touch it. You guys were ahead of that anyway. We didn't want to go there.
Okay. And the group voluntary insurance also, you didn't participate in that?
I'm not sure what to say again.
Like vision, dental?
No, my understanding was we were there for the ad hoc for the major medical, not all these other supplemental plans. They've never came up for a discussion at all.
Okay. Well, I would have liked all of you to have participated.
That's why we asked for direction.
That was the purpose of having the ad hoc insurance committee.
First time I hear it.
So,
I mean, when I came to present, I asked very clearly for direction. What exactly were you looking for? I only got 2 responses, and I have them, and we tried to follow them as much as we could.
okay. And also, how did you get this information, like the runoff fees? Like you said, MAA continues to charge BISD $145 per employee per month. However, the contract provided to the committee, these charges were averaged over a 12-month period of $143 per employee.
The majority of the information that's detailed like that, committee, specifically Mr. Rusterberg, did a lot of analysis on his own, did a good job at analyzing some of this information. That's why I opened by saying a lot of this information is nothing more than suggestions and opinions and ideas of what we've got. Someone still needs to go back and validate that that is accurate. The consultant, which is an independent person now that you've hired, is probably the ideal person to do that, because it's very easy, again, in a group, the way we were formatted, physicians, healthcare administrators, health expert consultants, employees. I mean, you're shooting in all directions. And everybody's got a focus, unfortunately, a different focus. To try to bring that home into one focus was very difficult. The majority of those details were brought up by Mr. Rusterberg, a couple by Lewis Jones. Those are the folks really that I talked to the most, or gave me the information.
And I also noticed here the reports indicate that it costs are up over last year's plan. MMA's projection of this year's plan costing $46 million is a $9 million increase over last year's plan.
That came out at the discussion, and it might have been at the MAA presentation. I don't remember which meeting. Was it? At the MAA presentation, those are the numbers that were presented to us. That's why we feel there's some really good suggestions here, some good ideas that you can put into place going forward.
Right. And I noticed that you mentioned this is the final report. Are you dissolving the ad hoc committee already, or?
I believe so, unless you, as a board, feel that we need to focus on specific things. What I don't want to do as the chairman of this committee is continue to have these meetings where we're shooting in all directions without really focusing on one thing, because those directions seem to change also. You go from one month to the next, and now it's a complete different direction. if the board in the future believes that another venture committee needs to come in and look at this deeper, certainly I would recommend that. I don't think a committee of 24 people would work, to be honest with you. And I think a committee that's much more focused on that is easier. And to be honest with you, I think the consultant ought to do it. That's why you hired him. That's why he's independent, rather than allowing folks from the community or folks that are consultants in our group to put in their input. It's very difficult to determine if they're really telling you what is true, or is it their opinion. Well, opinions are, dime a dozen.
Has one.
Exactly.
Everybody has an opinion.
Exactly.
And we're not going to go by
Yeah,
opinion.
and
That's why I don't
also-
think our committee needs to continue. I think it's frivolous.
Well, I also have a concern with you mentioning that there were personal agendas and political solutions.
Well, that's my opinion. I think there are.
Can you give me an example as to what you consider a personal agenda?
Well,
or-
I'll give you an example. The first meeting that we had, the majority of the folks really liked the MAA. They thought they were doing a good job. By the third meeting, a lot of folks thought that they ought to go out for bids. Now, somebody on the board listened to that, because by the time I got the information, you were going out for bids, but no one cared to send an email, at least to the ad
Going
hoc
out,
members.
out
saying
for
this
bids
was-
for what? I'm sorry.
I'm sorry?
Going out for bids for
For the plan, my understanding.
the health plan.
Yes.
Yeah, well, that's the procedure for us to go for bids.
But I would have wished we would have at least been
And I-
consulted to say, what do y'all think?
And I remember you saying that you didn't think that was a good idea, but, it's,
Well, and the only reason I didn't is because I know how it works. BISD has a terrible reputation of going out for bids constantly, so all these guys load up your fees, like some of Mr.
well,
Mr.
we would like
Garcia
to
was
give
saying.
everyone in the community and every employee an opportunity, to see if anyone else has something better to offer. That's the only purpose, and this is our main goal, to get the best things, deals and prices and coverages for our employees.
I
And
totally
the best
agree.
for a
And
dollar.
I'm right there with you, and again, my wife works for the district, so I have a vested interest in that as well. Just know that it's not as easy to get to that bottom line number. It was very easy to start breaking the numbers down and to start saying, well, you're charging this for this, but how much really are you paying for that insurance? And all of a sudden, it became a personal thing. Well, I want to think that every broker will probably do the same. I don't know. But someone needs to know. Someone needs to be assigned. Someone needs to be accountable to look at that. That's why the suggestion of a risk manager that's hired by the district, that works for the district, might be a good idea. Because then you have an internal person that's double checking that check and balance that President Garcia talked about is very key. I don't think that exists either totally. We have people in the district that are doing a very good job with what they have. But the purpose in the same time right now of cutting budgets, cutting staff, cutting this, cutting that, it's extremely difficult to try to really cut out all the fat of the medical plan. That's my personal opinion and my experience.
Right, yeah, and it's a shame that, prior administration or prior board didn't really take it easy spending money these last two years, and now we're going to have to really tighten our belt.
Exactly.
So, okay, well, thank you for your time, sir.
Hopefully this will serve as a good solid, again, suggestions that you can move forward. And I'll to Ken for some of the details that you were asking.
Thank you, Dr. Jimenez, for chairing and meeting and giving us this honest information.
You're welcome, sir. Anytime.
Thank you, Dr. Jimenez.
Good afternoon, President Garcia, Dr. Montoya, Ms. Longoria. First of all, I would like to thank each and every member of the ad hoc committee that took the time. It was a task, and we all learned something from it. I learned a great deal. Ms. Garcia, in terms of your question, I am in 100% agreement with you that if there is money due, we're going to get it. We're going to get it in the bank where it should be. What I am doing is I'm getting responses. I have a with Mr. Wright, and rather than try to give one answer here, one answer there, what I would really like to do is get a complete set of responses, work with the consultant to also do a review, and then present it to the board and to Dr. Montoya if that would be okay.
Work with what consultants?
With, the one that we hired, ma'am, McGriff?
Okay, first of all, let's go back a little.
Yes, ma'am.
Why weren't we notified that this money was owed to us? Even we had to go in.
Well, I believe what it is, in terms of what they're talking about, are the rebate checks, and
Rebates.
we have received them all, ma'am, to those that have been assigned. We have received them.
Okay.
Yes,
But
ma'am.
there's still monies out there that is owed
And they
to
will
us.
continue to be, ma'am, until the plan is exhausted and the rebate checks run through to the end of the program, the plan year. Yes, ma'am.
I saw some documentation. I don't know if that's all, but now that we have new administration, I'm going to go ahead and request. There's really no check and balance. I asked for a log as to who the check and balance when those come in. there's no log as to who's doing the check and balance and making sure that what is billed, it is what it is. And I guess that's where some of our monies is being, spent, where we're not really paying close attention to the billing or what we're getting billed for. So, I know that it's a lot of work. It entails a lot. You need to understand the codes of the billing. If you do not understand the codes of the medical billing, what they're billing us for, then it's going to throw people off. It is. It's, I just find it very hard to digest at this point that 2 years ago we were told we were with our pom-poms, we were throwing cartwheels because we had saved all these millions of dollars. At this point, in reality, it doesn't seem like we've saved any money. It went up. So, and rest assured, I know there's no savings because I have yet to see those savings. If I had a savings, my balance over here from the account that we're paying it from would be it'd have a cushion, and we don't have that cushion. So, there's a lot of, unanswered questions, Mr. Whittemore, and I think we need to start working very diligently, and I'm going to ask Dr. Montoya to stay on this because I am sure that there's money out there that we shouldn't have been paying, and we've paid, and this has been going on through the years.
Again, ma'am, I can assure you on the rebate checks, which I believe is what you're talking about, that we have received those. The billing, we do a reconciliation monthly of the employees, the ins and outs, those on leaves. It is reconciled. In terms of the medical billing, if I could get clarification on that later, I'd be glad to possibly get.
If I may interrupt, again, it's very easy to sit there and say, you need to know the codes. But it doesn't work like that in real life. That's why you have companies that are actually that know. Now, one of the things about MAA, for example, that's frustrating is you go do a procedure and they take a while to pay. Now, you're seeing a number low that month because utilization is not coming through. Once that's paid, you'll see it paid. Now, they do that because of their process to make sure that that procedure was necessary. Was it coded right? Was it any other things that were added? We went through a lot of our discussions with that, with Eric. So that was very important. So whoever you hire, just know that you're going to have a whole system in place. Not easy to do at all, guarantee you. So just to know, I mean, there's no way Kent or anybody.
And I understand, but you know what? And with the same token, if we have somebody that has that background, of course it's easier to pick up.
Well, do we?
It's easier to pick up, whether it's billing, whether it's coding, whether it's understanding how the billing is done and how we need to reconcile, how we need to check and balance. It'll be easier if indeed we have somebody that understands it very thoroughly. And at this point, we don't. Because
I don't think the district does. I don't think it ever has.
Exactly. And insurance, it's very difficult if you don't understand all the the little.
I'll give you some of the discussion that we had, because again, it sounds real easy. Like, you know what? Sherilyn is doing it. This person are doing it. We have 4 people that do 10,000 people. Man, that all sounds great. But that's all fantasy. I have, as you guys will know, I was a CEO at Brownsville Doctors. We're a self-funded plan, 200 plus employees. The billing department alone is 14 people. That's just billing. That's not even reconciling. Making sure that the actual bills are accurate, making sure that people are paying their out-of-pocket, their copay, and all that. So it sounds, because those are some of the discussions we had at our meeting. Hey, listen, I know a person of a district that has 6,000 employees and 4 people are doing it. Wow, I'd like to see that, because I don't buy that one. But anyway, there are opportunities, but just know that it's going to take a lot of solid background to get there. Do you need an expert maybe in site? Yeah, I agree. I think you do. Finding that person is not as easy. If you're going to find another consultant, it's just going to be another guy giving you his opinion, and you're paying a lot for that, just like you will with McGriff or whoever else. They do. So do you want the guy in-house that works for you, controlled by BISD, that tells you the truth? That's harder said than done. A lot of people at BISD don't speak the truth because they're afraid. Just know that in the community. But I think it's needed in the future. Absolutely, I'm with you there. And that's why I think direct contracting has got potential. But just know it's not going to be as easy to roll it out. Whatever I can do to help, let me know.
Thank you. Go ahead, Ms. Longoria.
Mr. Whittemore, isn't MAA our TPA right now?
Yes, ma'am.
Isn't that their responsibility to keep our record keeping?
Yes, ma'am, they do. And we do, like I said, they reconcile on a monthly basis with the billing that comes in. I was thinking two different issues in
So
terms of
there-
medical billing and the reconciling. The reconciling is done on a monthly basis, yes, ma'am.
So MAA is the one that does the billing, takes care of the billing,
They bill us monthly,
the
then we
third-party
process
administrator.
we-
What did they oversee? What do they really handle for us?
the payment of claims.
The
Yeah,
claims,
There's,
just the
there's
payment of
a
claims?
multitude of services that are involved in that. I'll get you the subrogation of claims. They do claims review, the payment. They double check for accuracy on medical payments. There's a
Because I also noticed some of here, it says that there seems to be some inconsistency and possibility incomplete reports or report.
Again,
their
ma'am,
part.
and you are correct, that's what it says, and that's observations based on certain members of the committee, which I assure you, I'm taking this, we got it today, we got it finalized, I will take this, I will be working with MAA, I will work with our consultant, and rest assured, should there be any concerns or considerations, we as a district, BISD have always built it into our contracts, into our bid specifications, we always have reserved the right to audit should we feel we need it. But I'm confident with what they're presenting, and like I said, I will get back to you with a report with responses to each of these areas to make sure that you feel comfortable also.
And when was the last time we received a rebate check from them?
We have up through, I believe the last one was July, August. They usually run about 6-month lag, so I'll follow up on that first thing in the morning. And that will be, you remember Eric Wright had stated at the last committee meeting when they do their quarterly presentation, they will start including that information on the financials. I know that was a concern that it wasn't being shown.
So how often did you say we're
They
supposed to get a
usually
refund?
run in about a 6-month lag.
6
Yes, ma'am.
months?
Yes, ma'am.
Okay,
I will get a listing for you tomorrow, and I'll email it to Mr. Garcia to forward to Dr. Montoya and to the board if that would be okay.
And the 535,000 that was pending back in January, did we already receive that refund?
I
535,000?
believe you may be talking stop-loss reimbursements, ma'am, and we do receive those
Did we get that amount
periodically.
already?
I will double-check, but we are current on the stop-loss refunds also.
Okay, oh, and I had requested some time ago because my other colleagues here that have been on the board already 2 terms or so, they keep mentioning that MAA have saved us 7 million or 9 million. I would like to see how they saved us that much money. If you can give me a breakdown as to how, was it in office visits, blood work, what kind of procedures? A comparison from the prior company or vendor that we had. I would like to see what areas we saved 9 million.
Because supposedly we were at the point in 2008, coming into 2009, we were at 42 million. That's what the district had paid out. And we were supposed to go below 40. And right now we're not below 40. It's not costing us under 40
Right, yes,
million.
ma'am.
So, and my point is, because it was all over the newspaper, and let's be transparent here. If it has not dropped below 40 million, we have a serious problem. We have a serious problem. Because we were told that we were going to drop those 40 million in cost of insurance. And apparently, if you can answer my question, where are we at right now
Yes, ma'am.
with figures?
I think what they're referencing in the Herald on the 9 million was the year from 2007, 2008, where we went from 37.6 to 43. And then the first year, last year with MAA, we went from the 43 back down to the 37. And then if you take that and you put it on a per employee per year and average it out and you calculate it, that's a potential savings of 7 million. And then I believe the other 2 million, there was a situation in claims that the prior TPA had submitted, Valley Baptist, they had not been paid. Valley Baptist had claims. The district had a potential liability of, I think it was 2.12 million on those claims. So I believe the information was taken from there, the 7 plus the 2.2 is approximately 9 million. Yes, we are back up this year and projected it into the 40, I believe it's the 43 million.
Can you give us a figure again?
The-
Costing 46 million?
I'll have to go back and check, ma'am.
That is what
I know
is here,
Mr.
sir. That is on the document, I believe it says.
I think that's what Eric Wright had
MMA
commented here.
projection of this year's plan costing 46 million, which is a $9 million increase
From last year.
from last year. So let's not make it sound that it's, it's all fine and dandy. It bothers me because I personally, when something is brought to this board, I know that we have to do extensive research and make ourselves knowledgeable and believe that administration, and I don't doubt that you do your work, Mr. Whittemore.
Thank you.
But let's remember that our employees work for the district, not for the vendors.
Oh, absolutely.
And we need to keep our feet on the ground where we need to fight them, and they cannot be dictating to us. We dictate to them. It's got to change. The mentality and the system for BISD, like, people cannot be dictating to us anymore. If they want our business, they better match it or beat it, and they better make sure that they give us the best deal out there, because that is what we want for our employees, and that is what we want for our taxpayers' dollars. We only want to be able to save so we can continue to give our their salary increases, so they can continue to afford their expenses that they have yearly, and that we can continue to put in the money in our classrooms where it belongs for our students' education. That's very simple. And if these people don't get it, then they need to go and do business with other districts that don't seem to care where their money is going.
I understand. Ever
Very
since
simple.
I walked out of the classroom, I understand that I am strictly here in a support service capacity, and I do everything I can to fully support the employees and the students of this district, ma'am. Yes.
And if they like money, tell them, well, you know what, give me the letter to report to my superintendent, and my superintendent needs to report to the board.
I understand.
I mean, very simple. I mean, if you find it hard, just tell them the board members require this, the board members are demanding this, and very simple. I mean, I know that sometimes it's difficult to be an administrator because these people just kind of say, hey, but it can no longer continue like that.
I've had a very good working relationship with MA, and like I said, I feel confident, but what I would like to do is get answers so that we all understand where we're coming from, and then if there's any concerns after that, I'll be more than happy to address them. I mean, absolutely. Yes, ma'am.
Thank you, Mr. Whittemore.
Thank
Go
you.
ahead, Ms. Longoria.
Mr. Whittemore, I'm looking at this
Yes, ma'am.
report that you provided. You had given to us before, but mine was stolen or something. Someone broke into my car and stole all my paperwork. The $7 million was saved. You have it under the 09-10 school year or fiscal year.
Yes, ma'am.
That's what they say. And I'm just wondering, do you have any idea, just off the bat, what area did they really save some of this money?
I will go back tomorrow, ma'am. I will review it and discuss it with Ms. Wright, and I'll pinpoint. I understand where you're coming from now. This was more based on a projection of comparing the annual cost per year and projecting out to try to get more of an apples-to-apples comparison on the number of employees. But I understand exactly what your question is.
I'm just
Yes, ma'am.
wondering, if it was the number of claims, the different kinds of claims that were submitted. And
You're
if
right.
s-
There's various factors. You
And
could
if
have
certain
large
claims
claims.
that were denied, where the employee had to end up paying for it. Is that how?
Well, there's a lot of
costs went
factors,
down?
ma'am. I'm sorry, I don't mean to interrupt. There's a lot of factors. You could have one year where you have potentially a lot of large claims and your stop loss kicks in, so the district's responsible for the first 300,000. You could also have, there's a big difference in your provider networks and the discounts that they offer, so there could be some percentage points in there that affects the claims and what's actually paid, the number of out-of-network compared to in-network, the facilities that they do visit. There's a lot of factors, but I'll be, like I said, happy to get you a listing of what factors really do influence that.
Yeah,
Yes,
I
ma'am.
would have, do have a concern if they got the savings from denying claims, and then at the end, the employee was the one picking up the tab, having to pay out of their pocket.
I understand, and you know what? We really have not received minimal complaints regarding MA, and if there's something like that, I'll tell you, I'd be the first, and I'm sure the association groups would be here too, because they'd be getting the calls and the employees themselves. But no, I have not seen that happen, but But I will definitely check into that and follow up. Yes, ma'am.
Okay, and Ms. Garcia, concerning or regarding the ad hoc insurance, I think we should review it before we decide whether we're going to dissolve it or not. And, you know, we might need them for other future projects or.
Okay.
Madam
Dr. Montoya.
President and Ms. Longoria and members of the audience, I think, again, Dr. Jimenez, you gave us some very specific, very good pieces of information, and the overall theme that I see there is that we need to monitor things better and try to get accurate information more effectively. And I think that's something out of our office administratively, we're going to have to work closer with the insurance, Mr. Wedmore and his group, to see what exactly is going on and what's happening. If we're not getting the district money back, we need to monitor that more effectively. And also, are the procedures and processes, are they in place? So truly, I do appreciate your comments, and I think, Madam President, that's something we will be working on to monitor the overall process. And you even stipulated some good areas that need to be looked at, so that guides us, and we appreciate that.
Yeah. Oh, go ahead. Are we now to, we now go to, anyone else in the ad hoc would like to make some comments? Oh, go ahead. Oh, because I thought you were coming into the public, so I was already going to. Go ahead.
No,
Go
I'll be
ahead,
back,
sir.
I'll be back for that too, ma'am. No, just a couple of things on this, and I think Dr. Jimenez did an excellent job as the chairperson. Obviously, as an employee, we're concerned about the increase in the insurance also. The thing that came up that we discussed, that was emphasized at the meeting where the MAA did the presentation to the ad hoc committee, was the utilization rate. And if utilization is going to go up, then cost is going to go up. And then whether it's the ad hoc committee or the EBC committee or whoever you want to look at it, it's going to have to figure out a way to reduce utilization and how we're going to address utilization. On page 8 of the handout of the minutes that Dr. Jimenez gave you, one of the things that or section 8, I think it is, section 8, my bad, my apologies. Under the direct contracting, some of the input from some of the members on the ad hoc committee was that as long as we have the contracts we have now, we're never going to know exactly all the information that's in the contracts and all the details because of proprietary information. And that's something that was talked about and discussed, and that would be one of the things that if direct contracting was considered, then the district would own those contracts and you would know exactly what's in it. And that was just one of the things that was, conversation was held on. But it sounds like if we can verify the numbers that were done by some of the members of the ad hoc committee, like Dr. Joe said, whether the consultant can verify that these numbers are accurate, then I think that gives the direction for us to look at. And I know that there's a couple of things that are already on my mind that I think the EBC needs to address on how are we going to look at the plan to address utilization, how are we going to keep the cost down. Thank you.
Thank you. And go ahead, Mr. Borrego.
I'm gonna, because I was on the ad hoc and make my comments. Ms. Lucy, you wanna continue that committee? It's a good idea, but I don't know if you picked up on Dr. Jimenez's comments. It needs to be a little smaller. Needs to be a little smaller. I served on a ad hoc insurance committee, long ago.
Yeah, I
maybe
did
10
too.
years.
I was there with you.
Oh, that's right. And it was smaller. Our meetings were better.
Perhaps we can have just appoint one board member instead
Yeah.
of two.
Right. The other thing was, one of the things that was mentioned was that the utilization for prescription was 6%. And, mail order, sorry, for the mail order, which allows the employee to get his medicines free if they're generic. And I think we need to implement a program where we can communicate with all our employees, especially our paraprofessionals, to get them going on the generic so that they can save money, because a lot of them are filling prescriptions and paying monthly to our local pharmacies, that I have nothing against the local pharmacies, but our paras are going to be losing days, and if we can help them out that way, but it's going to require a concerted effort to communicate and get these people on board. And I don't know if this is under the purview of public comment, but my question is, where are we on the voluntary insurance? Are we going to set that up again, or is that another meeting? I don't know. Is that another meeting?
This is an insurance meeting. If you want to, we can discuss that. Well, because this is the ad hoc.
One of our goals, obviously, from the previous board meeting was to revisit those areas, and we'd like to go ahead at the upcoming board meetings to do some presentations in that area.
Oh, okay.
So that it begins to open the doors so that we see what's out there, because correctly, and I think you're alluding to, that we need to make some decisions for our staff, our employees fairly soon. So no, it's not a dead issue at all.
Okay.
It will be brought back very soon, and you know, in different ways, information. Obviously, the board will also have to revisit selecting those companies and going from there.
Okay, thank you.
Maybe what we can do is a workshop for everybody, and then for them to do a presentation, then we can take it from there.
Yeah, that might be a good
So-
idea.
We'll
With
go ahead and
lunch?
follow up with that with a workshop.
We can
With
set
lunch?
that up, Mr. Whittemore and Mr. Garcia, maybe set up a workshop with some of these vendors, if you will, companies, and then, you know, at least an informational meeting so that the board and the community would have upfront information, and then the board could vote.
I think,
You know,
yeah, I think we voted to go out for RFPs again
For the voluntary?
for the voluntary. Was that it, Ms. Pat? Do you remember if that's what we voted on, to go for RFPs on the voluntary group insurance?
No, that it was turned down. It was turned down.
Oh, we
It
just
didn't
voted it
pass.
down.
It didn't
Oh,
pass.
okay.
It was
yeah,
voted
it was voted down.
It was
and-
voted down.
So I think what we can do is, and that's a great idea, let's do a workshop here fairly quickly with people presenting, and then go, so, okay.
Ms. Bettis, I'll follow up with Dr. Montoya on an email for that. I have it on my notes. Do we have any more ad hoc committee members that would like to speak or say anything?
Not on ad hoc, ma'am.
No? Okay. We will now go to public comment.
Ms. Garcia, or Chairperson Garcia, Ms. Longoria, Superintendent Montoya. I'm speaking to you now as the Chairperson of the Employee Benefit Committee. I apologize for not being at the meeting last week. I was out of town on taking care of family business that I'd set up way in advance. And the only thing I want to talk about is the process, because we want to do the best, just like you do, we want to do the best and provide the best voluntary products for our employees. And the process was that we set up a subcommittee of 10 members to review the bids, okay, to go through it and to rank them, and then to come back to the entire committee. I heard a little negative feedback that a couple of the people on the subcommittee happy with the results. So I checked with a couple of the other members, were there 5-5 votes, were there 6-4 votes, and everything I was told was everything was basically 8-2, 9-1 in that area. Then when we had our last meeting, EBC meeting on June 1st, it was brought back to the entire committee, a discussion was held, and we can send you a copy of the agenda. I have not received the minutes yet, but our secretary can send you a copy of the minutes too. And a discussion was held, and there was no concerns expressed, okay, on the voluntary products. Now, I think 3 or 4 of those products there did not have. It was just one vendor, and there was one where there was 2, and there was a vote on that, and I believe Davis won that one. But just on the process, the fact that the subcommittee of 10 people from various, some from this building, some are school, some are teachers, listened to the products, ranked them, brought back to the full committee. It was presented to, and the opportunity for discussion or for people to object was there, and it did not happen. And so that's why the recommendation came then forward to the board. and just wanted to let you know on the process, and that's all I have to say. Thank you.
Thank you, sir. Go ahead. Dr. Atkinson, go ahead.
Thank you, President Garcia, Dr. Montoya, Ms. Longoria. I chose to speak under public comment instead of ad hoc because I had some concerns with the report that was shared. One, the number 3, the renegotiate the existing contract with MMA to begin with. While it could have been said by a few members the first meeting, I don't believe there was a consensus. It was not on the agenda for discussion, nor was it voted on. And I felt, and I did share this with Dr. Jimenez and other members, I felt that that was not a recommendation I was comfortable with. Everything else I was fine with. I think for the most part, the information that was shared was very productive. I think the discussions were productive. Dr. Jimenez hit it on the head. There were several different parties involved, whether there were doctors, insurance people, district employees, interested parties, and you did have a variety of opinions and suggestions and perspectives. I think one of the things that some of us were really begging for was clear direction. And I don't think Dr. Jimenez got it directly from administration at that point, and that was difficult to be able to go back to the committee and really express direction. And while we wanted to probably fire a lot of questions at the consultant, Dr. Jimenez was very measured, and it was needed. It was needed because they were people coming from outside the district coming to share information. We didn't like half the information that was given, but nonetheless, he was very good and very professional at trying to mediate that group. It was a good presentation overall. Numbers, we didn't trust the numbers, and that was the bottom line. I think there was a large issue. The biggest issue there was a lack of trust, and I think Dr. Menace would probably agree with me on that, with the information being provided. And no, I think the district administration, including Mr. Whittemore's department, was trying to do their best to provide us the information we were requesting. Unfortunately, there were a lot of variances, and I think Mr. Rustenberg was really almost our committee expert that provided most of the rationale behind the recommendations that you see there. And we were very concerned that while it could have been said that previously there was a big savings of $7 to $8 million, why now we were looking at an $8 or $9 million increase. So overall, basically, it all stayed the same. It's a wash over the last couple of years. So we wanted to make sure that before anything else, and I'm again speaking under public comment, that something that Mr. Garcia and I are very, very keen on is making sure our employees have more input and more say in the process and in the products. Dr. Montoya, he asked us to have a big budget meeting with our principals earlier. The principals all really, really appreciated that, being involved in the process. Even though it was late in the process, they were included. They were part of the process, part of the decisions, part of the recommendations. So we really would like to see that for the insurance as well. I know that we're real good on SurveyMonkey and on email surveys. I think that's a forum we really need to utilize better, because it's and I heard Mr. Ortiz come to public audience this last time. When you have a handful of people making decisions, sometimes that gives the appearance of it being a special agenda or it not being as inclusive as possible. So if we can try to make the effort to include more employees in the decision making, at least at the preliminary level, and then you have your smaller, more centralized committee that would make the formal recommendations or the final. As long as everybody gets a chance to participate, to provide input, I think we're all going to be better off, and then more trusting of the information. So that was all I wanted to say. Thank you.
Thank you, Dr. Atkinson. Go ahead, Ms. Longoria.
I have 2 questions for Mr. Whittemore, if I may, Doctor.
Go ahead.
Yes, ma'am.
Okay. On these notes, that there might be overcharge amounts under the runoff fees. Have you had a chance to look into this to see if there is some money dues that will be due to us, back to us?
On the runoff fees, Ms. Longoria, what that is in terms of preliminary indication, again, I will get something formalized for you. It is my understanding that the runoff fees continued as part of a review of those claims that were not paid, that were submitted by Valley Baptist by the prior TPA. They had to be reviewed. Basically, that $67,000 cost saved us probably $2.1 million.
Okay, because according to whoever provided this information, that there should be no charge for runoff during the second year of this contract. And if in fact, if we received invoices and paid them, then we should have a refund, coming to us.
Again, I'll confirm that, but I believe those charges were from the first year before the contract was expired out.
We can just look into that.
Yes, ma'am, absolutely.
And then also this group voluntary insurance, is it necessary for administration or the employee committee, make these recommendations as to which vendors can come in and sell their products to our employees? How many group insurance do we have voluntary? Do you usually have a year, like 4 or 5, or how many?
No, ma'am, we have currently your dental, vision, your life, your disability, your Section 125, your cancer, accident, but we don't do those every year. I believe it had been several years since they had been reviewed, about 7 years. And basically, in terms of that, there's going to be a conference presentation for Tuesday that it'll cover a lot of it. But to answer your question, with the AFLAC situation last year, and I know Ms. Garcia, you'll remember this one.
Oh, it was.
There was a review, and part of our committee part of this presentation last week was to go back to Colonial. The employees, we have really utilized, like Dr. Atkins says, we really use the employee input from this and the full EBC committee. We feel it's strong because it's their products. But remember, there was also a review. It's real hard because of the contractual obligations if the district and the board approve it as an item, because then the board is responsible for a contract. And I'll resurface that letter, that review that was done, because I think it's real important to protect you as board members and us as a district in terms of that area. But if I could get that and forward that to you, Ms. Longoria, tomorrow, I think it'd help a lot.
There aren't any contracts. We don't have any contracts with them because it's with the employee. So the district doesn't have any contracts with
No, but
any
again,
of the
if
vendors.
it's board approved from their recommendation, then it's a district approved contract.
So how many vendors do you have, like for dental? How many are vendors?
Currently, we have one. We have the prior. I think what's real important to remember is that if an employee is happy with who they have, for example, if they have disability with Unum, they don't have to change. The district continues that payroll slot. It makes it effective for them for the other company.
I think the problem is that, okay, so there we with a certain vendor, and a new one comes in. Well, the one they're with is not present at the time, so they can compare, whether should I remain with this one or should I go with the new one. So that
Okay.
has been the concern out there.
Well, I'm sorry again. Go ahead.
And then
Go ahead.
also, wouldn't it be better, like say you have 3 different vendors that provide dental or vision? Couldn't just let all 3 vendors and let the employees choose who they want to go with? Instead of just limiting them to only 3 or 4 or 1 per vision or dental? Would that create a problem or?
I think it would create chaos myself, but honestly, I mean, there's talks of like a vendor fair. I discussed that with Ms. Pena at purchasing, but sometimes in order to get the group rate, as a group, we get a better rate. Sometimes they have requirements on the number of employees that have to enroll for them to offer and give you that rate. There's a lot of variances and things, regarding that.
Okay, well, I would really like to stress that that you do let the employees know that they do not need to change. They can
Absolutely, yes, ma'am.
stay with whom they are, because they're made to believe, or they don't get the information correctly, and they think that they need to go sign up.
Well, and I like I said, I learned from the AFLAC, and that was the reason why we came back. I told the board that, if the problems persisted, it would be addressed, and that's the way I addressed it. I think sometimes, like you said, and I fully agree with you, is that the misinformation comes from the enrollers. They try to do hard sells, and they make you think that you have to do it. Again, we learned from that in order to, the timing being this early, it provides a lot of time to give notification, to hit end services, to, like they said, work with SurveyMonkey, work with website postings, notifications, things of that nature, to really get a complete product and package out there for them. So I do understand completely what you're saying, and I've heard those same concerns. And again, the last thing I want to do is disrupt things for the employees, because they've got enough on their plate getting started back at the new year.
And also notifying with maybe a week in advance or 3 days in advance, because they don't get the word till that very same day.
I mean, it would be 3 months in advance.
Keep reminding them.
Yes, ma'am. Absolutely. Thank you for the comments.
Thank you.
Any,
Garcia.
I don't have any more. Anybody else from the public comment to step up to the podium?
I just want to reinforce the same thing that Kent was saying. It's on the voluntary products, we can keep what we had. When the Aflac came in last year, those of us who had the previous provider or the provider before that one had the opportunity to keep what we had. The only thought I had on your comment, Ms. Longoria, if you had a variety of people that could come in on that, I think the whole idea, what makes us attractive is that, you know, they want to have the exposure to all the employees. So that's the idea of getting the best rate is the more people they can to, is what hopefully would drive the best rates for our employees. And if you brought 3 or 4 different ones in, then I don't know if we'd be actually getting the best rates. That would be my only concern. Okay, thank you, ma'am.
I'd just like to make a correction on these, when you do change the company, if, like, for instance, you have a cancer policy, they're individual policies and they sell them individually. So if you change companies, they can't keep the old company and refuse to take the new one. Now, when you have a group policy, like for instance, a disability, if they make a change, that's it. The disability, that one is out and a new company comes in. The whole district. It's not a choice because it's a group policy.
The disability.
The
Disability
disability.
is
It's not like your vision and dental.
Other, like dental, other types of policies, they're individual, so they sell them, that's why the agents sell them individually. What we do is just enroll. And I just wanted to make that correction.
Okay. Thank you, Mr. Ortiz. Do we have any other public comments? If not, this meeting is now adjourned. It is 6:35. Thank you.